or good evening to all, and welcome to this first session of the digital skills training. I'm happy to start with this. And as Irena said already, this one is going to be on the role and specific of digital services in the package of HIV, HCV, TB, and STI services for key populations. I'm Lella Cosmaro. I work for an NGO based in Milano, Italy, which has been offering services for HIV and the other infections for over 30 years. And so I am here to share with you some of the things that we follow and we do in this field. Next two slides. The next one, okay, thank you. So we're talking about vulnerable groups and digital services and tools, but this is not a suggestion. This I want to make clear, to close our premises and switch to digital services. This is not the purpose of these training sessions. Why? Because vulnerable groups, and we're talking about people with drugs, migrants, LGBTQI plus people, or sex workers, or even homeless people, other vulnerable groups, they experience many barriers in accessing services and healthcare facility for the prevention, treatment, and care and testing services for TB, HIV, and the other infections. And they experience these barriers due to stigma and discrimination, or for repressing and punitive legislation and criminalization of their behaviors. And our harm reduction services need to ensure low threshold access and offer warm and welcoming environment and space, encouraging them to come to a safe environment where they can take care of their health and possibly solve other pressing issues. And some people like elderly people, migrants with language barriers or cultural barriers, homeless people who often do not have easy access to the web, also uneducated people most likely need vis-a-vis support and physical access to harm reduction services, since they would not know how to seek otherwise the information and help that they need. So they need our face-to-face support. We have to welcome them, we have to empower them, and offer them services, giving them the dignity that they deserve. But other people prefer to seek online services and support because of many reasons. The first one might be distance, because maybe they live distant from harm reduction facilities. They want to protect their own privacy and anonymity. They have familiarity and prefer using online services, maybe because they are very young and they just are used to be in contact with people through the web. So our services must be adaptable and capable of intercepting the different needs, providing effective responses to everyone. So the digital services are not better nor worse than vis-a-vis services. They are just a different option, and we need to be prepared to offer them in order to complete our best practice toolbox and be close to all of our clients. So I will now briefly introduce a few of these digital services and tools. They are not exhaustive, of course, they are just examples that you can think about in preparation for the next training sessions. And they're mainly available in English, apart from a very few examples that you will see in other languages. So we need to keep in mind that language is a high barrier in accessing our services, together with other cultural and social differences. And you probably already have and use other resources in your own language that are useful for your clients. So I would like you now in the chat or later on, or by sending them to us, I would like you to share what other resources in your own language you have and you refer to as digital services, because they might be very useful in order to complete our toolbox of digital tools that we will share and develop and maybe translate at the end of these training sections on digital tools. It would be great to have your contribution and add them to the toolbox. Next slide, please. So let's start with the first, in this sort of path going from prevention to care. And the first step that our potential clients need to make is to gain or to improve their awareness on the risk related to their behaviors. Talking about drug use behaviors or sexual behaviors. And so people who are not comfortable in coming to our services to learn more about risky behaviors can find tools online that can support them in risk assessment and in adopting prevention strategies to minimize risk taking. And you could promote these tools just through your social media, so that inviting your clients to access them and assess their risk that they have by clicking on the links. The first tool that I'm going to introduce is the Risk Radar. It is an app that was created very few years ago, like in 2020, during another EU-funded project. The app is called Risk Radar, and this specific component, the Risk Radar has many components. The specific one we're talking about is the risk calculator. It is presently, right in these days, under review, but it will be soon back online and you will be provided the link. And it is very easy to use because the risk calculator starts by asking people to answer very few questions. The first one is on gender, you know, the client's gender, their country of origin and residence, their sexual orientation, sexual behaviors and drug using behaviors, and if they had any vaccinations for hepatitis or other infectious diseases. And at the end, this application gives a comprehensive answer on the potential risks that people have taken and gives advice on what to do to take better care of their own health. If you see this example, after the people have filled in the answers of the short questionnaires, they receive answer about their sexual risks, if they have risks or not with their sexual behaviors, and information about the risks connected to sharing, injecting equipment. And for people, gay and bisexual men, they are advised to get vaccinated for hepatitis. And they also receive information, if they are foreigners coming from abroad, about hepatitis C or TB screening because of the high prevalence of certain infection in their country of origin. So this application is user-friendly for migrant people, for people using drugs, for men who have sex with men, and for the other vulnerable groups who can find information about the risk that they took. The next one. This application, it is interesting because it was assessed for their effectiveness in 2020 when it was launched. And as you can see in this slide, the people who use the risk radar in a high percentage were thinking of changing their behaviors or to take further action after having consulted the risk radar. 76% of them decided to take further action, and as you can see in this figure, they wanted, many of them decided to get tested, some decided to seek advice, some other decided to start PrEP or to start treatment or to notify their partners of risks taken. They either decided to see a doctor or to schedule a next appointment or to stop sharing injecting equipment. And this is important, meaning that we don't know then if they, after deciding or saying that they would take these actions, they did, as a matter of fact, take these actions, but at least they were brought to think about taking good care of their action, and this is an important thing for prevention. So these applications are important for risk assessment. Next slide, please. Another one, which is presently online, I just checked, is this It Start With Me application. And again, it is the same method used. So it's just an app that asks very few questions about behaviors and gives advice at the end after people have replied to the questions. This is only for HIV, differently from the risk radar, and it's already available and can be promoted online. Next, please. I'm sure that you have in your websites, in your organizations, or most of you have a session with information about the infections, about HIV, hepatitis, other STIs, or TB. And of course, it is important that our clients and the people who come to our services have some literacy about these infections. They know about how to prevent them and how to treat them if they are treatable, and how to get the treatment, where to get the treatment. If your websites, or if people do not know where to refer to, the app that I talked about before, the Risk Radar, has another component made of fact sheets that were developed together with the ECDC, taken from the website of the ECDC, that contain very simple information on transmission and treatment of these diseases. They are available in the app. And of course, if you have already information, if it is in your own language, or if you have to rely in this application and share it with your clients, it is important that this information is updated, because of course these applications, these infections often have developments and new treatments available, and so it is important to simply, with simple words, update the information that we make available to the clients. The next slide, please. Okay, this is an important step that the people, after they have known about the risks that they took and decided that they have taken risks, that they go for a test. This is the presentation of the European Test Finder. The Test Finder is an old application, started from by NAM 8MAP almost 15 years ago, I think, and it was in many languages originally. Then it was passed on to the Eurotest initiative, and it's now in the website of the Eurotest. It's the European Test Finder. The good thing, the important thing is that you can, if you're not already listed in the Test Finder, and if you run testing services, if you offer testing services, you can enroll, you can include your organization in the Test Finder, providing a lot of information about your organization and indicating which type of tests the clients can find in your organization. And there is a very easy procedure to apply for the Test Finder. And we are encouraging you to do this in order to build up on the number of organizations that you can find here. This is covering not only the EU, but all the European region. So also Eastern European and Central Asian countries can apply. And after the war in Ukraine started, and due to the many migrants from Ukraine accessing Europe, this application has been also opened to include our other services, i.e. OAT services and ART services and services for the treatment of hepatitis and TB in other countries. And I think it's been also translated into Russian and Ukrainian. And so it is not only available for testing, but in some countries, especially for Poland and other countries which received a lot of Ukrainian refugees, it is also including a lot of information on OAT services and treatment services, not only testing. So really you are encouraged to use it. It's very easy to look for the testing services because you just need to select a country and the city, and the application will show you the closest testing sites. It is easy to understand if they are community testing sites or checkpoints, or if they are hospitals and or other sites. And yeah, and also this can be promoted easily through your website info session, or through your social media to your clients, in order for them to easily find somewhere to get tested. Next slide, please. So in this session today, we will not talk as much about digital services for drugs, for information on harm reduction, for the drug use themselves, but rather for the treatment of the infectious diseases that we are talking about. But in the internet, we can find many applications, mostly in English, but not only in English, as we said, on the risks connected to the use of substances. Today, we're just going to have some information about one of them, just to give an example of online digital apps on drugs. And Adria Quesada of Energy Control in Spain is going to talk to us about the Trip app, which is an application that he knows very well because it was involved in its development. And therefore he's going to explain us what it is about and what people can find in the trip app. So please, Adria, you can take the floor.
Thank you, Lella. My name is Adria Quesada, and as you said, I'm an IT consultant based in Barcelona. I am one of the former programmers of TripApp, and I will show you a little bit what is TripApp and what are the objectives. So TripApp is the collaborative effort from three NGOs. One is Help Not Harm, the other is NewNet, and Yoda. And also we had participation from the National University of Ireland and Youth Rights. Also, we did some collaboration with Sexist Free Night for mapping services in our database. So the goal of the project is to reduce the harms associated with the use of substances using a mobile application that is available for Android and iOS. The application is very privacy oriented. We don't store any GPS information. There are no analytics and no ads. There are many features, but basically one of the main used ones is the services database, where users can search harm reduction and similar services around the world. Here in the first photo on the filters, you can see the filters for finding services on the database. And we have mapped services in more than 25 countries. Not all of them in Europe. We also did some collaboration in Asia. The application is translated into 25 languages, and there are more of 3,500 services on the database. Also, we have some information like a list of pills with their analysis results and other relevant info, such as the origin of the pill, colors, and photo for identification. There are also some information on drug use, like the set and setting, routes and administration, and so on. And also some information about laws in different European countries related to the use, possession, and supply of substances. The application has been downloaded more than 10,000 times, and we have downloads from United States, India, Germany, from all around the world. Finally, the services web map, as you can see on the right, can be checked on the apps on the mobile, but also on a website. So if you go to tripapp.org, you will have more information there, and also the link to access the web map for checking on a browser. Thank you.
Congrats.
Thank you. Thank you. I've seen that Adria's application on the TripApp has received congratulations from Christos. And we are definitely early with respect to the break that is foreseen by the program. And so I would like to open now the floor for possible questions to the people, to the participants, so that we maybe divide the questions about this part from the rest of the presentations following the break. Is there any questions from the floor? Have seen something from Nadia, I think.
Yes. Yes, hello. Hi.
Hi, Nadia.
I just wanted to ask Adria if it is possible to add our services in the TripApp, since we provide a lot of services on harm reduction for people who use drugs. So just to know if it's possible to add.
There was that feature to add services to the database. If you go to the website and click on the add service category, there is a form to fill with the information on your service. And I'm not working with them anymore since 2 years ago, but there used to be someone that was checking that information and adding them onto the database. For making sure, I'll recommend to send a message to the email that is down on the webpage to make sure that the service will be added. But yeah, the functionality is there.
Okay, thank you so much.
If anybody has any other question related to any other service that we previously saw or any other tool that we previously saw? Yes, no.
No, apparently not.
Okay, I think Lella, everything is so far so clear. So I think we can use a little bit more time into the presentation and take the break a little bit after. If you think
Okay.
that's okay.
So I go on to present some of the things coming afterwards, okay? So I will have Ariana's help in going forward. Okay. Now we are sort of switching from digital tools to digital services. And we're talking about online consultations. You know that, and you probably did the same, that many of the community organizations have set up a section on their websites with platforms to book online appointments, and now also vis-a-vis appointments. This was very important during the COVID time because our services needed to close, and we wanted somehow to maintain contact with our clients. And so I think that each of us started to organize themselves to adopt some platform or some way to establish contacts and to provide online peer services or even professional services to help out with people. So we are going to talk about these digital tools. This example that you see on screen is the digital platform that my organization uses for counseling. And as you can see, it is possible for people to book an appointment online. And you can choose the date, and you can choose the time, and you can choose if it is in presence, I mean face-to-face in the services, in the service, in the premises, or otherwise online through a Zoom call. When people select a time and date, they leave their email and receive a link or a telephone number that they can contact if they want to have the counseling via telephone, or they are fixed the appointment and they come to our premises. It is very important to have these digital tools available for establishing contacts. And I would like to introduce, if it is possible, the first part of one of the presentations that the friends from the Cobatest network were going to provide after the break. I mean the one connected to the presentation of their new tool for making appointments available for the Cobatest members. I'm asking Maggie and Miguel if they are available to give the presentation now. Or Laura even. I see Laura, but I cannot see the Maggie or, oh, here, yeah. There she is. We will drive you to the presentation, but Ari needs to skip to the well, first introduce Maggie, introduce us to the Cobatest, and then we will go down to the presentation of the tool. We will find the right slide and you will give the okay to Ari when she gets to it.
Perfect, absolutely. Can you go back, or you cannot go back either?
Yeah, here.
Perfect. Thank you, Lella, for presentation. As Lella said, so Laura, Miguel, and I, we're all here to represent Covates Network. Today I'll be presenting, I'll just say a bit what's the network, and I'll present two tools that we use, that we created for our members. One is data collection tool, and one is appointment tool that we're currently working on. So some of you already know us. The ones that we don't know, we're a network who links, as you can see, who links organizations across Europe and now in Central Asia as well. We work with CBVCTs or community testing centers to promote testing, early diagnosis, and linkage to care at risk population groups. Currently, we are, I'm sorry, I just have some notice on my, you can hear me in English, right? I just have a notice in English, okay. Oh, please go back. I just have notice of saying that the language is Indonesian, and I don't know why, but you understand me in English. Okay, perfect. Okay. So currently we are in 29 countries, European countries, and 2 Central Asian countries. And as of today, we have 114 community testing center members. And the network is coordinated by us from SACECAT and A-Section Europe from Germany. Now you can switch the slide, please. Thank you. So the mission of the project of the network is to promote community-based HIV, hepatitis, STI testing and linkage to care, to improve services across Europe and Central Asia, to share good practices, to improve activities of community testing centers, and to provide tools to strengthen collaboration between the members that we have. So we do different things that you can see on the right side of this slide, as in we facilitate sharing of experience to make new contacts and partnerships. We have, as I said, free data collection tool for our members, and now we also have a free appointment tool. Well, we're finishing up the free appointment tool for our members. And a part also, we're working on awareness raising of the work of the community testing centers for our members through, reports, scientific publications, and other similar activities. Yes, if you can click, I didn't know that I couldn't do this, so sorry about that. And once again, so this is the 2 parts that I'll be concentrated, obviously, because this is a services. Oh, no, you can go on the next slide. Digital services presentation. So I'll be talking about online data collection tool and what it gives you. Well, one is it collects standardized data. We currently improved that data collection form that we have based on the expertise of the community testing centers and also other expertise in the field. It has been improved towards direction of key population groups, and in this case also for harm reduction, adding more questions or tailoring the questions that we had to better present today's reality. We also have, so this data collection form is not just like one page in terms of just one information, will be gender or behavioral factors. We have several models that you can choose from. They're not obligatory. You can choose the ones that you need, and you can also add models that are specific for your country or for your center even. And we will see one of the screenshots that we have, like a model for Belgium, for example, or Italy or Cyprus as well. You can manage your data easily. It's very user-friendly. We will see that too. And this is also very important. You can choose different languages, so you can have the form and the questions in different languages. As long as you ask for it and you also provide the translation, we will put that online and also in PDF form in case you use the paper form before you put the data in the system. You can also extract and analyze your own data, and besides just extracting in an Excel format, you can extract in graphs and reports that are already done for you, so you can use that for reporting for your donors or for your in-house purposes to inform outreach projects and so on. And the last one, you also form part of COBA test report. It's a yearly report that we produce, and we analyze data of our members according to the European level indicators for HIV and VIH and STIs. And besides this, we also have 3 different manuals that you can use to understand how this program works. We have written instructions, we have video, and we also recorded a training that we conducted with our members where you can also hear the questions from the members, which is very useful because they use it every day, so they really do know what to ask. And besides that, you can always ask us. So yeah, it's digital, and also you have direct contact with us. If you can change the slide, please. Perfect. So this is how this is the front page. You sign into the form, into the tool from our website. You put in the username that we get, username and password that we give you, and then you see this. So you can see this is the first homepage will be the list of all the tests that you have done. You see that the first one is the ID and the third one as well. So it depends if you use unique identifier that we have. So it's for privacy purposes, or the one that you in your center use, and you can input that as well. You see the date, you see the center in case if you have more than one center, one branch of your center, and you also see the person who inputted this form. Next slide, please. And this is how the form looks after you click adding new form. So you see there are various modules. So those are various tabs that you can click on. So the ones that are circled in red are the ones that are commonly. So you see this. These are on. You don't have to fill them all in, but this you will see. Then you can ask if you want questions on PrEP or if you want questions on chemsex. And then in blue squares, you see these extra modules that I've been talking about that you can add in case your center or your country has some specific questions that you need, maybe just for reporting as well, that are not part of this common questionnaire that we have. Because we also, when we develop this form together with the experts, we think of, I don't want to say broader audience, but we think of all the members that we have. So we make sure that it's short enough so you actually have time time during your consultation to have this to go through this questionnaire, and the client will also dedicate the time, but we'll also make sure that those are important questions that everyone needs to know. But then you again have the option of a module that is just specifically for you. Please change the slide. So this is just an overview that not all the questions are mandatory here. It's just, it does say mandatory questions, but it's not really mandatory. It's we ask if you could, these are important questions, so we can then generate reports for you with important indicators. And those are, and these questions are in red square usually in the program. So it's very user-friendly. If you just want to fill in just the main questions, you just follow this and see the questions that are marked red. Then also you don't see all the questions and all the answers because there are questions within the answers. So unless you click the answer that has other questions attached to it, you're not going to see this additional question, and you will not feel a bit overwhelmed, no, because it can be a lot. Just to say, printed, the main form is just one paper, so like 2 sides of one paper, so it's quite short. If you can change. Perfect, thank you. After you save it, then you will see the last form that you save it in the front, so you have like nicely ordered everything. Next slide, please. Okay, so it's very user-friendly. As I said, you can change the languages. These are just some of the languages that we have there now that our members requested, but we can add whatever language you would like. You can also change the center in case you have more than one center, more than one branch within your center. Next slide, please. As I mentioned, you can export data, and you have different ways for exporting it. You can just export your data in an Excel regular format. You can export the data with including the dates. You can export data and generate graphs like you can see right here on the right side. It's generated by risk group, by month, gender, or age group. Next slide, please. And as you can see, you can take it out. It will be downloaded as an Excel or as a PDF that also has an Excel that you can download afterwards. And the last option that it has, you can generate a report. So like indicators that we generate every year, that we interpret and we generate every year. You can also do that just for your center specifically with the report button. And this is just an example on the right side how this PDF would look. Next slide, please. Okay, so this was just for data collection tool. And now we're talking about online appointment tool that we developed, and it's in process of implementation soon. So why did we develop? It was more, we developed appointment tool. It was asked by our members because many of them or were using, excuse me, if you can change to next slide. Because many of them were using Google Calendar or couldn't afford to ask for their own, to pay for their own program. And as we know, Google Calendar is not really safe and not as user-friendly. And also clients could only get an appointment if they call or if they went in person. So we tried to address this need and created this tool. Next slide, please. Okay, so we have two interfaces to this appointment tool, one for the center, excuse me, one from the side of the center and one from the side of the client. So you see two different ones. One from the side of the center. What it helps you to make an anonymous appointment for a client in a safe manner, manage your calendar. Hi, excuse me. This winter is not really kind with me. Excuse me. It also helps you to filter and export the appointments that you have by name or by date or by type of the appointment. Will be counseling or testing or counseling or testing for specific service. It also allows you to send automated reminders to the clients unless they say that they don't want to indicate their email or they don't want to indicate anything. And you can also add notes for your clients. So when they register, for example, for I don't know, whatever testing, they will get a note saying, okay, you have to come, I don't know, without eating or whatever you want to communicate to them before, so they know what they have to do before they have to come to do whatever service they requested from you. And then you have client's interface, where they can simply make an appointment for themselves online. They select location, they select date, time, and the service they require, and it's also anonymous. Next slide, please. So this is how the client side looks like. So it's, as you can see, it's very basic. It's very friendly. It's gonna be easy for them to use this tool. They just indicate the center. This is in case there's more than one center, one branch in your center. They indicate location, they indicate service they want, the schedule, as in they want to come in the morning, during a day or at night, and they indicate the date, preferable date. As you can see on the left lower corner, they can also change the language of the interface. Again, and then they just hit search and just find the available appointment, available day and time, and professional, and choose just the one they want. Next slide, please. So this is how the system looks for you. As you can see, it's basically a calendar which lets you just to click on any date that is available. If it's not available, it will be marked. And then you will create an appointment. It has filters, simple filters, advanced filters. It has an option of changing the language. It gives you an option of creating. So if you want to create a specific agenda for yourself or for any employee of yours, you can create a specific agenda and say, okay, this person works from 9 to 12. and then they're not available, or they work on Monday or Wednesday, or et cetera, et cetera. So it does really give you a good flexibility, and this person will not be shown as available for any time or date that you have blocked. Yes, and then this is compared to data collection tool. This tool is managed by you, so you do have an access to an admin part, so you can add more centers or more services to your own to your center without. You can obviously contact us, but you can run the whole program without us. Next slide, please. And this is how it looks when you try to create an appointment for someone. So if you click on the date, this is what's going to be, this is what you're going to see. You choose the service date, so which agenda, if you created different agendas for different employees or for your center, or you just have one agenda, depends on really on you. Email, if they want to give an email. Duration of the consultation, so not all consultations are the same time, I assume, so you can actually indicate how much time this consultation will take, and you can also choose a professional which will attend this person. Next slide, please, and you can add any comment to that. Next, so this is next step in the same window. So then you can choose if you want this appointment to be repetitive, as in if someone has to come every month or every 3 months, you can indicate here, and that will be booked for them, and they will get a reminder as well. Or just one time, which will be just none, and that's it. And last step, next slide, please. It's just a summary of the appointment. Next slide, please. Yes, so this is the last slide from me. So what we have done already, we already developed the tool, as you already saw. We presented it to our members. We got a feedback. We adjusted it to the feedback. We tested the appointment tool. Right now, we're cleaning out the bugs, and then we'll implement the tool in pilot. And if in the pilot everything works well, if not, we'll clean more bugs, and then we'll implement it to all the members. For all the members, as data collection tool, it's free to use for any members of Covates network. Thank you very much, Lella.
Thank you very much, Maggie, and thanks to the Covatest friends. When would this tool, do you have any idea when it will be online available to the Covatest members?
We hope soon, but as you know, as I mentioned, we currently updated some things in our data collection, so we have a lot of bugs and a lot of urgent things there. So we're working on that first, but this is next in line after we're done with the main parts of tool. We don't have a date. Miguel, correct me if I'm wrong. We were not able to have a date to put a date yet, because we have the same IT company working on data collection tool as they work on appointment tool, and we're trying to prioritize. Yeah.
Okay. Thank you very much. Are there any burning questions before the break? Burning. Christos?
Yeah, I wanted to ask about those. They look very nice, but when you make this digital tool, did you ask any user how it looks like to him? Because I know from the streets the people have only very cheap phones in their hands, and is it possible to go through all this with a phone, a cheap smartphone in your hand?
Do you mean?
Yes. Yeah. So I'm sorry, that was the question.
No, my friend. Thank you for the question. Nice to meet you. Just to clarify, you're talking about the client side, right?
Yeah.
Yes, I have tried myself, and you can go through, and I would not be able to tell you with all the phones, because we didn't try with all the phones, but it is smartphone friendly. So as long as, it's not previous phones that we had that didn't have, much to it. Regular phones for now, we could, that's a good point. And we can find someone with not that, cool phone see if it's going to work there as well. But so far from regular phone, it did work. And we did present the whole tool, you know, the part of the client and part of this part of the center to our members in last June. And we got a feedback from them, and then we tried to adjust it to the feedback they gave us. But that's also why we're doing pilot, because that's going to be very important. We hope to receive more feedback and see, you know, no one wants to have more bugs or something like that, but like pilot is very important, so we can clean it and make it even more user friendly. And if there's, you know, extra questions, just take it out or so on. But yes, that's very good point. Thank you.
Thank you. Thank you.
Laura, Miguel, if you want to add something. No, we're good.
No.
Should we break, Irena, seeing that you came online?
I think that it's 5 o'clock. I just want to remind everybody that the COBA test webinar is going to happen within this project and within this working package in 2025. So make sure to follow the Boost website, and we're definitely going to be sure to send you the information in time. So keep in mind that. And yes, Maggie, you want to say something?
Just to add, I can put my email in the chat if anyone wants to contact me and, you know, talk about tool or about network. I'll be happy to do that. Is that okay?
Yeah, I think Laura already did that.
Oh,
yeah. So don't worry. We are definitely going to provide any contact or connection if anybody wants to follow up after the training on this, and we will have the mentorship process. So also we're going to be available within the next year or two up until the project is running, and maybe even after. Now I have Indonesian as well. So yeah, I'm going to start the pause and we can go on a little break. You can relax, you can go to the toilet, you can go drink water. Be sure to walk a little bit because we're sitting already for an hour. And then we're going to come back in half an hour. Is everybody okay with that? You don't have to leave the Zoom. You can just turn off your camera and your microphone, and then we're going to be back in half an hour. Great. So I think if everyone agrees, we can continue with our second part of this event. And thank you so much for being in track with time and being still with us this afternoon. I'm not going to speak a lot. I'm just going to give the floor to Lella to continue her presentation.
Yes, thank you, Irena. Yes. You were going to say something else, Irena? No?
No, I'm just going to leave you the floor.
Okay.
Thanks.
Okay, so we start back, and this second part of the presentation will mainly have to do with the 3 digital online services, example of online services. One is in support of self-testing. The other one is on PrEP, teleprep. And the last one is in support of TB treatment, adherence to TB treatment. And for this last session, there will be a guest speaker other than me, and I'll introduce it to you in a few minutes. Before that, I will talk to you about services in support of self-test. We need to mention, first of all, that I am not sure, but I am aware that it's almost sure that in some countries, self-tested has not been added yet legally to the toolbox of testing opportunities for people. In my country, because I will give you the examples of 2 services, one is Irish and the other one is Italian. My country, self-testing has been available and approved since 2016, but up to the COVID pandemic, it did not have that much uptake, also because after the initial communication about the availability of self-tests in pharmacies, people probably forgot about it because there was an initial promotion and then everything stopped. And self-tests are sort of expensive because they cost around 20 euros to 25 euros, depending on the brands sold in pharmacies and the different types. So people are not very keen in buying, adopting them. During the COVID and during the very hard lockdown in the first period, people could not get to hospitals because they were sick. They were over booked of people with COVID, and they could not come to community testing sites because of the lockdown. And therefore, in our services, we started to promote the news that self-tests were available and that we could help people to self-test. So at that period, we were advising them. This is the promotional picture that we put on our website. It says, take the test in your home with our remote support, either via telephone call or Zoom. Book now. So people could get to our appointment tool and book online support. Online support means helping people throughout the process. I mean, literally following them to do this and do that. So making sure that they perform the test correctly. Of course, this is more, it's easier to check when people are online via Zoom or by telephone by giving them the correct instructions. But of course, the support is also psychological because some people are scared of getting the results while they are alone on their own. And so the person online can give psychological support to them while reading the test result. Next one, please. Here you see the service that Ireland have implemented, the Irish colleagues of HIV Ireland have implemented. It's called Empower Yourself. And they deliver free self-test kits at home, at the home of people for free. People can book their self-test online through their website, and they receive a lot of information before they book the test and after they book the test. Of course, before booking the test, people need to be aware of the window period, of useful information regarding how to take the test, about, as you see in the slide, about U equals U, or about what is PrEP, what is PEP, the use of condoms. So general information about how to prevent HIV and having taken risks. And then if they apply to get a self-test, they are advised on how to take the self-test. And there is also a session that they put online, of course, on what to do if people have a reactive test. People can get in contact with them in the telephone, with the telephone, and they can receive support and guidance on where and how to get a confirmatory test. And information also on treatment, available treatment, because people maybe are not aware that nowadays people living with HIV on effective treatment have the same life expectancy of other people, and they are not transmitting HIV through sexual behavior. So there are all this sort of information available on the website in the session dedicated to Empower. The other service that I'm going to present to you, next slide please, is the service that my organization implemented in Italy. It's called Just LILA, because we just sort of mocked Just Eat, the delivery of food that you probably have also in your countries. And also we have developed a landing page on our website where people can find useful information about HIV prevention and how to get HIV and how to test. They can order their free test kit online. They have to enter before ordering and giving their address, brief questionnaire collecting social demographic information so that they know who their our clients are, where they are located, what city, if they are located in a city or in a small rural area, so to understand why they do not access testing sites, traditional testing sites, and we ask them about their sexual orientation and behaviors as well, and risk-taking. The people then in a separate page, which is deleted soon afterwards in order not to keep personal information, they have to give us, of course, their name and address where they want the test delivered. And then they are guided on how to perform the self-test. Also in this case, of course, they can book the remote counseling service to be assisted while they perform the self-test as before. And they can also give us a feedback on how their experience was with self-testing and if they would use it again, both in the Italian and in the Irish experience. Self-testing is free of cost for the people. It has a cost, and so it needs to be funded by some funders that we looked for. And the feedback of people, which was very encouraging, it had very enthusiastic feedbacks, higher than 90%. Very good, excellent services. People would like to self-test even more. We have given a webinar on self-testing in the COBA Test 2023 program online, which is available, I think, on the COBA Test website and is also available for you. And the service, the website, and all what is necessary to implement this service is also available, and we can share it with any organization who would like to implement an online service for self-testing. It was made for the COBA Test members to take advantage of this pilot program. So it would be eventually available also for other organizations and your organization if you are thinking of implementing such a service. So all of the landing page and the database for the questionnaire and for sending the tests are available for you if you need to access this. One important information that I'd like to share with you about this service is that more than 50% of people who became clients, we had over, in 1.5 years, we had over 2,000 people, 2,000 clients using the service. Over 50% of them had never tested before. So it means that this service is available, is useful for people who otherwise would probably not go for many reasons to either healthcare facilities or even community testing sites. Even community maybe because we are not so widespread in the countries in order to be able to welcome all the people who would like to test. So self-testing is a good opportunity for those people who don't know where to go and don't want to access healthcare facility because of stigma or other reasons. Next slide, please. Another service that I'd like to talk to you about is teleprep. Is a service for offering prep to people. And first of all, we need to remind that in some countries, PrEP is not available yet. In other countries where it is available, maybe it is not reimbursable. In Italy, PrEP became reimbursable in last year in May, and we started this teleprep service before the year before. It's still ongoing, and we hope to keep it going until it is necessary. For sure, it will be till the end of 2024. Before the PrEP was made reimbursable, many people accessed our service because there are only 4 checkpoints in Italy delivering PrEP services, 1 in Milano, 1 in Bologna, and 2 in Rome. And of course, they cannot take care of all the needs of all the people who would like to access PrEP as a prevention tool. And there are infectious disease hospitals that offer PrEP services, but they do it on top of their regular services for treatment of HIV and other infectious diseases. And so they have very limited time devoted to PrEP services. Therefore, people who want to start PrEP have long waiting lists in front of them. And this is why we opened the PrEP service online. It is, people can book the first call for getting information about how this works, and they receive a first counseling with a peer worker, and who assesses whether a person knows what PrEP is and what his needs or her needs are, so that they can decide together if PrEP is the right prevention tool for this person. If they agree to take part to the program, they have the PrEP service is complicated to manage because they are asked to take some tests. The first one is the most important, is the HIV test, to make sure that they are HIV negative at the time they start PrEP. Then they have to take other tests, blood tests, to check some of their renal functions and other medical things. After they send us the tests, before then they have to send us the privacy agreements, because this of course implies the exchange of medical files and records. They send us the results of the tests. They are admitted to the test program if they are eligible, and they have every time counseling with a peer, and then the consultation with an infectious disease doctor, always online, who after the end of the consultation prepares an online prescription for PrEP, and the teleprep staff sends the online prescriptions to the clients, who go to the pharmacies and buy PrEP online. This happens still now, even now that PrEP became reimbursable. People accessing our services need to pay for their PrEP. 1 month PrEP in Italy costs around 60 euros for daily daily prep taken every day. So if you instead have prep on demand, the cost, of course, it's lower because you only take prep whenever you have risky behaviors, mainly sexual behaviors. And people who are on this program, on the prep program, have strict monitoring. They have to take another HIV test after 1 month, and they have to take every 3 months their regular follow-up tests, as they would do in a prep clinic, and send the results again to the teleprep service and have another consultation with a peer and with a doctor to make sure we, apart from the medical things, check on their adherence to PrEP, on the risk that they take, and we try to collect, of course, anonymous behavioral information of increase in risk-taking and number of partners and chemsex use and other useful information to have a picture of who are the clients engaging, choosing to have teleprep services in Italy. We try to refer those people who call from those cities where PrEP services are available to direct them to the checkpoints or to hospitals, but in some cases they cannot access the regular services, as I said, due to queues, to a long waiting list to be taken into consideration, and so they refer to our service. Some other people in remote rural areas or in regions where services are not as efficient, especially in southern Italy or in the islands, are very happy that there is teleprep services, because otherwise they could not access PrEP. And therefore, this seems to be a very important resource for people who want to have PrEP. As I said, this is a rather complicated service to be managed online. It requires a lot of databases, files, connection between infectious disease and peers, and collection of medical records. But we think we have implemented a very secure system, and we are ready to share information and advice to those people who would like to support clients in getting PrEP online through an online service. We have almost presently 200 people followed on PrEP since 1.5 years, and we could have more, but we cannot have PrEP services every day ourselves, because we are a small NGO, and we will see if this is going to be needed for improvement of the service, or if maybe little by little, by spreading more PrEP services in hospitals, waiting lines will be decreasing and people will be able to access reimbursable PrEP at no cost in hospitals, which would be more beneficial for them, of course, if there is no waiting time and more hospitals providing PrEP. So this was for PrEP. And as a last...
can we go through some questions related to teleprep you were just mentioning? So there is 3 questions in the chat. One is about language barrier, and it's mainly about how migrants can access teleprep without knowing anything. The second, so maybe it will be useful to explain us which are the target groups the teleprep is available in your country. So we are
Okay.
So we have that answered.
So teleprep officially is mainly available for men who have sex with men who have high sexual risk in sexual behaviors, but unofficially it is available for all the people who request it, because we think it has to be available as a prevention tool for anybody. So anybody going to the hospital or to a checkpoint can have PrEP. As probably many of you already know, there is a difference in PrEP between men and women, because for men, it is PrEP is more not effective even if it is taken on demand rather than daily, while for women, due to physiological differences, PrEP has to be taken daily in order to be effective, because otherwise it does not give enough protection. So people on PrEP are mainly men. Women, if they use it daily, usually they get discouraged, because maybe they don't have sex as often, and then they get tired of taking pills every day if they don't have frequent sexual activities. But anyway, it is open to all. The language is a barrier. Actually, in our organization, PrEP services are available in Italian and English. So people French sometimes, because French and Italian it happened that we could try and counsel people on PrEP, but it's only a matter of having doctors on the other side in the hospitals able to answer the requests of foreigners. So as for all health services in hospitals and checkpoints, we are not able to satisfy the requests of people coming with different languages, if they're not English, French, Italian, maybe Spanish, because it's also similar to Italian. Otherwise, language really represents a barrier in this sense. The other question, Irena? You're muted.
Sorry, other is exactly what you answered right now. How many women, including trans women, do you have in your teleprep service?
Very few, I think 3 at the moment in our service. And in any way, in Italy, the total number of PrEP women on PrEP in the country at the last check that we made was really low, like 3-4% of the total number of people on PrEP, which is not a high number.
And also, do you have any migrants in the program?
Yes, in our service, we have, I don't know why, people from Lebanon. We have a community of people from Lebanon. Probably the voice spread in their community, and they started PrEP. They luckily talk English quite fluently, all of them, so we can follow them in English, both here with the peers and at the hospital. I cannot think of anybody else at the moment. No.
Thank you. And there has been one more question. How do you deal with the people with complex medical history? Do you send them to a center, or how do you work around that?
This is mostly up to the doctors, because the consultation with the doctors, apart from the doctor receiving the first tests that are required by protocol to enter PrEP, either with our service, but they are the same as entering PrEP in any hospital. In Italy and in most of countries, I guess the protocols are mostly the same. The doctor needs to ask questions about any other diseases that the person have, and they decide together what is best for. So it happened that in some cases the protocol tests were okay, but then the doctors, I think it happened in a couple of cases due to other diseases or medical condition, health conditions, decided that it was best not to put the person on PrEP. I cannot give you details because I don't know them. I'm sorry.
Okay, so we can continue. Any more
Okay.
questions? No, I don't see everybody, but I will try.
Okay, next slide. This slide is just to say that there is a Facebook page which is called PrEP in Europe, where people who want to have information and look for PrEP services in Europe can find such information. It can be accessed, of course, on Facebook, and it's managed and updated regularly. It's a first, let's say, entry tool to find information. Of course, again, English is a barrier for people who can understand English and have first-hand information about what is PrEP, who can have them, how it works, and so on. Now, I'm going to move on to the digital services in support of TB adherence. And as I said, I am going to give the floor to Christina Silen, and she is going to present this new part to us. She's from Moldova, and lately, as you can see from this image, there has been a lot of attention, especially in Eastern Europe, but not only, on delivery of TB digital technology services for PrEP users. So I would like to introduce you to Christina and give her the floor.
Thank you, Lella, and good evening. Hi, do you hear me well?
Yes.
Okay. Good evening, everyone, and thank you for your patience to be here at this hour. My name is Christina Celan, and I am program coordinator at the Center for Health Policies and Studies, which is based in Moldova, but implements regional projects in Eastern Europe and Central Asia, and has quite vast experience in implementing digital tools, first in Moldova since 2007, and then lately in other countries from the region. I'm also a member of the Digital Adherence Technologies Task Force, which you see here, the image from the website. Next slide, please. As tuberculosis is a disease which needs more attention in administration of the drugs, and the adherence is one of the most important factors to a successful treatment outcome. But at the same time, due to the side effects of the TB drugs and other factors that do not need the individual requirements of each person in treatment, the adherence is the one that suffers the most, and which leads to loss to follow-up, to treatment failure, and to TB deaths in the end. So that's why probably TB was one of the first fields where the supportive tools, digital tools, were looked at. Moldova, for example, has the experience of implementing video-supported treatment since 2014. as a pilot project, and lately as currently is a national method of treatment, standard method along with DOT. It is part of the clinical protocol, so it's something that it's offered to each person which is eligible and finds feasible this option of treatment. Mostly when we speak about the digital tools for TB adherence, and you'll see that the title of in this slide is hyperlinked, and you have the source is the Digital Adherence Task Force platform, where you can see that we mainly speak about 3 types of tools, which are the medication sleeves labels, the smart pill boxes, and the video observed treatment. When we speak about the medication sleeves labels, that means we have the blister with the pills, and a short code usually is written on the verso side of the pill, when the patient can just take the pill from the sleeve, see that unique code, and can send it through SMS or through a short call to the number they have been given when they were included in this program. And in this case, the calls are going to an adherence platform, which is matched that the person has taken the pill or not on that day. If the person did not send the call or SMS, the health worker usually is calling back at the end of the day or next day and asking why they did not report the treatment intake. And there is the possibility in the adherence platform, in case the patient says that actually I took the pill but forgot to call or forgot to send the SMS, or I didn't have enough credit on my phone to do this. And in this case, the medical, the healthcare worker can include manually the those in the adherence platform. This is the most simple, let's say, a tool, and it works in areas with limited internet access, with limited resources such as sophisticated phones and need for additional equipment, because that tool works very well with a traditional phone with buttons, so you don't need internet, you don't need a smartphone, you don't need additional equipment to procure. You just use the phones that the patient usually have. The minimal requirement is depending on country to countries. You need to have some balance on your account, but usually these calls and SMS are free. It's just the requirement of several several telecom providers who do not perform calls with zero balance on the phone. But speaking about the credibility of this tool, we cannot be sure that the pill was taken. It can the usefulness of this tool can be only measured against the treatment outcomes, and or with additional analysis, investigations that show the presence of the drugs of TB drugs in the body of the person. So it is mostly likely and usual in countries in Africa, in Southern Asia. However, not used and not even piloted in our region. When we talk about the smart pill boxes, that's another tool which have as the sleeves also has some reminders on the phone. This pill box has a sensor which is sending the input or signal to the adherence platform once it is opened, and the pill for today or for the day when it's taken is pulled out of the box. It is more easy to use for patients because they do not need to do anything, do not need to send any SMS, any call, so it's automatically sending the signals to the adherence platform. Again, not really we can monitor the treatment intake. It is mostly based on trust that patients really take the pills, and also can be monitored and measured against the treatment outcomes. In our region, the smart pill boxes are used as a pilot project in Ukraine, which is funded through the Ascent project and it shows it shows to be beneficial, especially in people with sensitive TB. Because it's a shorter treatment, not so demanding for the patient. And the most resource requiring tool is the video supported treatment. It used to be called video observed treatment. Once we go to the more people-centered terminology, we replaced this term with video-supported treatment. It requires usually a smartphone and internet connection, some abilities to use the phone and the platform, because it can, in some countries, it is done through calls or videos sent through public messengers such like WhatsApp, Viber, Telegram, Skype in some time ago. But those public messengers have some limitations, let's say, because they are not communicating directly with an adherence platform where the treatment intake is marked, and it is not so secured in terms of confidentiality or data leak from the perspective of patients. That's why it has been developed a few country own systems. There is also big developers which have this VOT module or VST module for which usually countries pay per patient per month for use. But countries in our region went to the option that is more sustainable for the country, because you can, once we have donor support, we can pay this monthly price. Let's say it was like $9 or $10 per patient per month to use the platform. At some time when we in Moldova, for example, we were looking at this option, but when we did some calculations and assessed the sustainability to be continued after donor funding is ended, then we thought that it's better to have our own system, which will remain with the country in any case, and will not depend on any donor support. So if you can change the slide, and I will talk about the free tools that are in our region used for the adherence to TB treatment. Actually, in Uzbekistan, it was largely used the WhatsApp and Telegram. Now they are switching to the the WhatsApp, Telegram. They started some time ago with the support of USAID. With this year, they will switch the entire country to the country adapted system. And we have three systems. One which was developed in Moldova, and I was part of the developing team, is I Like VST. The second one is developed in Georgia and is Adhere to TB. And the third one is developed in Belarus and is part of the national TB registers and all systems. It's linked with all TB digital systems existing, called Lekar. So if we look at the funding in Moldova, we developed it first with the support of TB Reach of Stop TB Partnership. Now is supported through the Global Fund, but not the system itself, mostly the interventions along with the support to treatment. In Georgia and Belarus, it was the Global Fund funding. And currently, the I Like VST Moldovan system was adapted for Tajikistan, Uzbekistan, and are rolled out there. And also is adapted for Turkmenistan and planning to be rolled out. Not yet, has not been yet used, but they have it. The Adhere to TB treatment Georgian system was adapted and is successfully implemented in Armenia and Azerbaijan, and they had a pilot project in Kazakhstan, but stopped at the regional level. And the Belarusian system is mostly subject to adjustments for replications due to its linkage to the national TB register. And except the Georgian system, which became available for iOS this year, late in 2023, the other systems are only available for Android system users. And you have here the contact persons for each of the systems in case some additional information, but as well you can check the quick guide on video supported treatment for TB, which is developed by WHO and available by WHO Euro and available on the WHO website. And you'll see all the detailed information about these free systems in case some countries would like to overtake them and to compare the pros and cons. Next slide, please. As I said, the applications are available on Android and the Georgian one on iOS as well. And the mobile application is, it consists of a web application and mobile application. The mobile applications is mainly used by patients, and the medical staff is using the web platform, where they can monitor the videos every day. They can see in case a patient is not did not send a video today and follow up why that happened. They can send responses and monitor the overall adherence of the patients, and intervene there where there are signs of non-adherence or not very careful intake of TB drugs. The application has not only the feature for recording videos, depending on country to country. You have also, for example, the I Like VST has other modules or compartments, which are the educational materials, information materials for patients, everything about TB. The patient can go there and read, also having some support messages from other patients, or how we call them, success stories. They have the map with the delivery points across the country, and there is also a module which can be accessed not only by the patients using the video supported treatment, but it's an open model used for the community-led monitoring, where all patients, not only those in VST, can report any barriers related to access to care, to the quality of care, and the civil society organizations working in TB field can help them, also can identify the systemic barriers in the delivery of care and propose adjustments. For the Georgian one, they have they have also the reminders as the Moldavian one as well, such as Belarusian one, and they also have the interface that includes medication history and help. So the user can activate the with a PIN code activation, switch the language, and do other settings. Next slide, please. I will not go into details.
Thank
to
you,
the
Christina.
Yeah.
I would ask you to be brief, because we just have 7 minutes and we have to do the evaluation. And so if you can just have 1 minute, thank you. Sorry for interrupting.
So here on this slide, you also have more information about the features that these tools have, and what is important. It is not only the video sending, but also they can report. For example, in Moldavian and Georgian systems, they can report the adverse effects, the adverse events, and the doctor can help them by calling and appointing them. And the next slide, which is the last one, I guess. yeah, so that was actually the last slide. You can find more about these tools in the WHO guide, and also if looking at the digital adherence technologies task force where the link was provided. So happy to answer to any questions if we have time, and if there are some urgent need for clarification. In any case, you have my contacts there for future clarification.
Thank you, Christina. I open the floor for questions now, and I want to give an explanation because I've seen that Eliane disagreed with my answer, and I totally agree with her disagreement. Probably I explained myself wrongly. Our service or people in Italy do not mean to discriminate women who want to take PrEP. I was meant to say that some women who are taking daily PrEP because on-demand PrEP is not okay for them, decide to quit because they feel it is too much for them. We try to support them, and anyway, if we do not succeed in supporting them, we are advocating together with some other European organizations for the introduction of injectable PrEP that lasts for 3 months and solves for men and women the problem of adherence to PrEP and the problem of not being covered by PrEP on demand for women. So while waiting for injectable PrEP to be available in Italy and other countries, whatever we can do is support them on daily PrEP or explaining the risk of on-demand PrEP for women. We have time for burning questions, or otherwise I know that Irena said that we will take care of answering all questions after the meeting, and also those that will come into the evaluation form that you have to answer. I give the floor to Irena.
Yes, thank you. So, George, I think we do have time for one more question or several questions. In the meantime, I will send the evaluation.
There was so much information. I mean, very, very much appreciate all the information. I didn't know that so much is out there. So then I just keep the question for later and stick to the compliments.
Yes, I think you can add the question in the evaluation form, and we are going to make sure to collect everything. And also when published the manual, we're going to have a Q&A section in the manual to answer all of the specific questions to the best of our knowledge and to be as much as detailed as possible.
Super, thank you very much.
Yes, Christina?
Yeah, I just wanted to add, because of the audience here, that the Moldavian system we developed for TB and was already adapted for other countries for TB. We also adapted it for opioid substitution therapy. So we are about to start hopefully next week, enrolling patients as a pilot project. And we will see how this works also for people in opioid substitution therapy, especially for those, because in Moldova, it's not very practical or usual to give methadone and buprenorphine for home intake. So although there are people at some stage already taking the therapy at home, we would like to implement it for those who are in the stage 2. They are already stabilized, but not yet the doctor is ready to give them home doses. So for a period of 2, 3, 4 months to monitor them, to see how they are able to take the therapy themselves without coming every day to their point. So that's what I wanted to add in terms of of the digital tools that we are working with. Thank you.
Thank you, Christina. So I'm also sharing the link for everybody who wants to register for the next training session that will happen on 6th of March at 4 p.m. I received several direct messages, so I'm sending it to everybody who wishes to register and didn't do it so far. I'm also send the form for evaluation, and I will appreciate everybody to fill it in. We will also send that evaluation form via email for those who left early, but I urge you to fill it in right now because it's just 5 minutes and your memory is still clear on the presentations you heard today. So I think you're going to help us big way in doing it right away. So is there any more questions while people are filling in the survey, or do you need any urgent question to ask? Okay. People are filling in the survey, I guess. Thank you for that. Lella, do you have anything else to add into this session? You're muted.
Sorry. No, I just wanted to thank Christina and all the other presenters, Adria and Maggie, and you, Irena, and all the organizations and the participants for having actively taken part in the meeting. And I'll be there also in the other sessions and hope to meet you all again. Thank you.
Yes, I would also extend the thanks to Alexei for translating all of the presentation in Russian.
Yes,
and also
thank
supporting
you.
us in this
Thanks.
process.
Sorry, Alexei. Big thanks to you.
Yeah, so if you're done with the evaluation, thank you so much for being with us today, and we see each other next Wednesday at 4 p.m.